We'll talk about another very important topic as related to heart issues, that's heart diseases. So this is what is known as aortic insufficiency. Aortic insufficiency, right? So aortic insufficiency is also known as what? Aortic regurgitation. Okay, like in the aortic valve, as blood goes in, it's supposed to just go in one way. So if some of the blood is leaking down back again, that's an issue, right? So aortic insufficiency is also known as what? Aortic regurgitation is a heart valve disorder where the aortic valve fails to close properly. So blood will now what? Go in, but some of it will fall back. Okay. So what happens in aortic insufficiency? There's valve malfunction. So the aortic valve doesn't seal tightly. Okay. So there's increased workload. So left ventricle now has to work extra in handling blood that it already handled. Okay. There's progressive damage. So it can lead to left ventricle hypertrophy and the rest of them. Now, causes and risk factors. It could be valve defects, it could be rheumatic heart diseases, it could be due to inflammation of the heart valves, aortic root dilation. Sometimes it's due to some injuries, or sometimes it's due to age stops. Okay. Now, issues that such a patient that is having blood regurgitation from the aortic valve will be having include they'll be weak, they'll be having difficulties in breathing, their heart is beating irregularly, that's palpitation, chest pains, that's angina. There's sometimes they might have edema, okay, that's accumulation of fluid in their extremities, but that one is mostly seen in advanced cases. Now if you want to pick up that condition, you do physical examination where you're listening to heart sounds. You do echocardiography, okay, MRI or CT scan, cardiac catheterization. Okay. Treatment, mild ones, you just keep monitoring the patient. Okay. But if it's actually getting advanced, they use drugs that will help the blood vessels become wider for blood to flow more. That's vasodilators. Drugs that will put out those retained fluid from the body. That's diuretics and beta blockers. Then sometimes if it is surgical intervention, you want to repair the valve or replace the valve.